All right. Good afternoon, and thank you for tuning in to Maya Bowser's Maternal Monday series. My name is Sybongile Cook, and I am the Director of Business Development and Strategy within the Deputy Mayor's Office for Planning and Economic Development. And it is my honor to be here today and be your host. For this segment of Maternal Mondays, we're going to focus on prematurity awareness and its importance, since November is Prematurity Awareness Month. As you may know, premature birth and its complications are the #1 cause of death of babies in the United States. 1 out of every 11 is born premature. So we want to take a few minutes to talk about this very important topic and share some prevention measures and resources and share ways the community can get involved. So today I'm excited to be joined by 3 members of Zeta Phi Beta Sorority Incorporated, Omicron Phi Zeta Chapter. These ladies have agreed to share some information about how their sorority and the chapter have been involved with prematurity awareness and the contributions they've made in this very important issue. So without further ado, I would like to introduce Ms. Carla Blake, Ms. Tikina Lewis, and Ms. Rashida Madison. Welcome, ladies. How are you ladies doing this afternoon?
Great.
Good.
Wonderful, wonderful. So first I'd like to ask Ms. Carla Blake a quick question. Why is prematurity awareness important?
Well, first, let me say good afternoon and thank you for having me. I'm excited to talk with you today and our viewers about the importance of prematurity awareness and Zeta Phi Beta Sorority Incorporated's longstanding history in this space. Zeta Phi Beta Sorority Incorporated is a community-conscious, action-oriented organization, and our tenets are sisterhood, scholarship, finer womanhood, and service. And one of Zeta Phi Beta Sorority's signature service programs is the Stork's Nest, which started over 40 years ago, in 1971 to be exact. And the Stork's Nest is a program that we are in partnership with the March of Dimes Foundation. The goal of this program is to increase the number of women receiving early and regular prenatal care in an effort to prevent cases of low birth weight, premature births, and infant deaths. Because every 12 hours, a woman dies from pregnancy-related causes. Nearly 1 in 7 women don't even have health care insurance, and African-American women are 3 times more likely than white women to die from pregnancy-related issues nationwide. Wow. So the Stork's Nest program is designed to promote prenatal care participation and encourage healthy behaviors during pregnancy through incentives and education. Stork's Nest clients can earn points towards incentives such as maternity or baby care items through a variety of positive health promoting activities, such as attending prenatal visits, participating in prenatal education classes, stopping at-risk behaviors such as smoking cigarettes or consuming alcoholic beverages, and avoiding stressful situations during the pregnancy. So Zeta Phi Beta Sorority Incorporated is proud to say that currently there are more than 80 Stork's Nests operating nationwide.
Wow, wow, wow. That is truly impressive. And I thought I just heard you say, did you say over 40 years of doing this here within the organization? Is that correct?
Yes, that is correct. We've been doing this over 40 years, doing this work over 40 years, and granted, November is Prematurity Awareness Month, but Zeta Phi Beta does this year after year, month after month, so we are dedicated to this charge.
That is fantastic. Thank you, Ms. Blake. I'm going to pivot to you, Ms. Tikina Lewis. I understand that you work in this profession, and I really would love to hear a little bit more about how can expecting families prevent premature births, and then maybe you can share a little bit of the experiences that you see.
Okay, good afternoon, everyone. My name is Tikina Lewis. I work as a neonatal baby nurse, and I also work in labor and delivery. So prenatal care is the health care you receive while you're pregnant. Some of the risk factors to having a premature birth are pregnancy with multiple babies, problems with your uterus, your cervix or your placenta, smoking or drugs. Infections is really a big one, high blood pressure, diabetes, stress, multiple miscarriages, physical injury or trauma. Premature births occur when a baby is less than 37 weeks of gestational age. 34 weeks, most of the time, or all of the time actually, automatically go to neonatal intensive care unit. Some of the things that I have experienced as a neonatal nurse are, especially with babies, is jaundice is the most prevalent one that we experience with babies that are premature, and that's because the liver is not matured enough yet.
Mm-hmm.
Babies that are underweight, which are 24 grams, usually get sent to the NICU. Babies have respiratory issues, sometimes have to be put on a ventilator. Babies have blood sugar issues. They become very cold and cannot be warm. They also have heart issues. I've had babies that have cerebral palsy, babies with vision and hearing problems. A lot of times, the reason why premature birth is experienced is not only because of comorbidities, but because the woman does not go to the doctor or get prenatal care. A pregnancy sometimes is unplanned or unintended, and I usually find that with teens or women that are 30 years and older. But this is prenatal care is so important because when you go to an OB, they take you in and do your checkups. They do tests where they test for disorders or diseases that you may have. They educate you on healthy living. They educate you on medications that may affect your baby. They also keep up with your baby's development. It's hard sometimes to watch a family go through that, simply just because the mother didn't get prenatal care.
Wow. I mean, number one, my hat off to you every day working in an environment where you're trying to help women, families as they're giving birth, and you see this. You mentioned a lot about jaundice and then blood sugar and trying to keep the babies warm, and that has to be number one, a labor of love to go through that every day. But just kind of the things that you talk about, it again speaks volumes to how important it is to go and get checkups, be sure that you are advocating for yourself as a woman and a family that is getting ready to have a child. How important it is, because it sounds like this is prevented if you can go and make sure that you're taking care of yourself and this child, before it's born. And so that's really helpful. Thank you, Ms. Lewis. Is there anything else that you would want to share about how important it is for mothers and families to come into to meet with their doctor, their provider, so that they can kind of get this assistance?
Yes, I mean, as I stated before, it's so important because it can be prevented a lot of times. Even if you have a disease or you're dealing with a lot of time, especially as a Black woman, you deal with high blood pressure or diabetes or certain comorbidities. Even with those, you can still if you get the right care, it can be prevented.
Mm-hmm. Mm-hmm. Absolutely. Thank you so much, Ms. Lewis. I'd like to pivot to you, Ms. Rashida Madison, and discuss some of the impacts of prematurity on early child development. I know that you were in education, and so I'd love to hear a little bit about the impact of premature births and early child development, if you'd like to share.
Thank you. Thank you for having me. As an early childhood educator, we try really to enforce that infancy to 5 years of age is very critical time for you to really observe your child, and children, and just have an array of people to help you observe once you go through a premature birth. Children born prematurely often have language difficulties, problems with visual, motor processing, and attention problems. So learning disabilities may not come visible right in hand, but once they start school, they become to be, plain and, in the same. So you try to get a chance to best to minimize it, and the effect of the learning disability. You try to get the child the help the child needs with certain assessments that needs to be done. Early intervention assessments is the process of going over their fine motor, their language, their cognitive development, social, emotional, and self-help skills. So those skills are very important when a child is growing from infancy to 5 years of age. The earlier that a child is evaluated, the sooner that the intervention can begin. So it's just very important I stress to my parents to have the intervention process in order. And you can have some of these intervention processes by going to an early childhood site if your child goes to a center, or their physician when they do their baby early checks.
Okay. So, I mean, I remember you mentioned between infant to 5 years of age. So you're encouraging parents who have had premature births, encouraging them to go get these assessments done early,
Yes.
Meaning, does it continue up to 5 years, or you continue? I mean, does this happen
early,
regularly as you are?
Early, periodically, because when you're born prematurely, things don't come as sooner as you think, or it may not be visible to the parent. It may, like I said, it may come sooner. It may come when the child's in first or second grade. You may tend to see certain things that your child's not grasping, and so that comes in effect with certain assessments that can be given at the certain type of centers that are given.
Wow. It didn't really dawn on me until you mentioned it that, you could connect premature births to, and may not be able to see that until a child is in school, like first and second grade, and it may have never had an assessment. And now you see some of these things, materialize when they are in school, and not have connected it to a premature birth. And so I think what I'm hearing from both you, Ms. Madison, and Ms. Lewis, is that definitely when you're pregnant, obviously make sure that you are going to your provider or a center to make sure you're getting some prenatal care. But then secondly, after a premature birth, that you want to make sure that you are taking your child in to get assessments done, and not just one time, but maybe a few times over, between 0 and 5 years of age, and maybe even a little bit older. Can you talk to us a little bit about what are some of the resources that parents and families can go to for some assistance?
Certain places in early childhood education, we use Strong Start. Mm-hmm. And they do pretty well with assessments and assessing a child, observing how their cognitive development is, and how just certain steps of fine motor skills that they have, things that they evaluate. And Strong Start is a very good program for that.
I heard that they also, in early prevention, they also do in-home services that are available
Yes, they
too.
do have in-home services as well. I mean, if you don't want to engage with other children at times, and I mean, at trying times like this with COVID, they do have a lot of intimate sessions for you to go to the home.
Wow, that's fantastic. So if anyone that's listening today, I think where you can get this information and access it, number one, is on the dcmaternalhealth.com website. And then also the thriveby5.dc.gov website, where you can see all of the resources that are available free to parents, to mothers. You can get this information. Definitely look up Strong Start. That is one place where they're definitely doing some early prevention assessments, and also some in-home services that are available to all district residents. So I think that is that's fantastic. For all three of you ladies, are there any other things that the organization is working on in this month? I know that the organization is going purple for Prematurity Awareness Month. Are there other activities or awareness that you guys are doing through this month?
Yes, we do have another event that will be held virtually at Brooklyn Union Baptist Church, and we're doing a prematurity awareness presentation, just giving more information and giving insights to prematurity, and that will be November 15th at 10:45 a.m.
Okay,
So
November
please
15th.
feel free to log on.
Okay, that sounds fantastic. Thank you so much, Ms. Madison. Again, I did want to stress that if you're looking for more resources, we definitely want you to come to the dcmaternalhealth.com website, and also the thriveby5.dc.gov site for all information and resources that you can find on premature births and how to prepare your family, also to do assessments as well. Those resources are available to you. Once again, I wanted to allow each member here on the call today to just kind of share any other lasting thoughts or impressions before we close out today.
Sure. So again, we really just want to say thank you for letting us share some information about this very, very important topic. And we will continue to do our part in the community to spread awareness about prematurity.
Absolutely. Thank you so much, Ms. Blake. Ms. Tikina Lewis?
Yes, again, as Soror Blake said, thank you for allowing us to be a part of this. Also, as you stated before, those resources, I just wanted to encourage every woman that is pregnant or hasn't abstained, hasn't had prenatal care, to use those resources, or even go to your local hospital, and they can also help you with that.
Thank you so much, Ms. Lewis. And Ms. Rashida Madison?
Thank you for having me again, and just want to leave the mothers with a special note, just saying, really use your educators, that we are really there for the parents and family and guardians. We really, really want to help your child, go above and beyond. So please let us know any questions or concerns that you need for your child, because we are here to help.
Wonderful. Thank you, ladies, so much. These are the ladies from Zeta Phi Beta Sorority Incorporated, Omicron Phi Zeta Chapter, here sharing a little bit about Prematurity Awareness Month. Again, thank you for tuning in to Mayor Bowser's Maternal Monday, and we hope to see you soon. Thank you so much.